Welcome to the Happy Dog, Happy Human podcast, where we explore the intersection between human mental health and our relationships with dogs. This is Sharon.
And I'm Angela. In season 2, we're exploring social and cultural phenomena that impact our well-being so we can reduce stigma and challenge the status quo, while also learning better ways to care for ourselves and our dogs throughout the journey. We hope you love it.
Hey everyone, this is Sharon.
And this is Angela. Welcome to our second to last episode of season 2, which means one more topic to go. And we are very excited to dive into the topic of neurodiversity. And in this episode, we are going to discuss what it is, what it means, how it has impacted both Sharon and I personally. And then we will have a break to hear from our sponsor. And after our break, we're going to talk about how to challenge ableism and also how to challenge internalized stigma if you do identify as neurodiverse. Yeah.
Awesome. Cool. I'm looking forward to this conversation.
Me too. But I'm also ready to take some breaths because I don't feel centered right now. So I would like to feel centered.
Awesome. I'm so glad that you named that. So let's care for ourselves with a few deep breaths, and then we will get into this topic.
Sounds good.
That always feels so nourishing.
Yes, I totally agree.
Mm.
Yeah. Well, welcome back and also Happy New Year. We survived the holidays and we're in a new year with some intentions that I think we both have our own intentions and goals to see this new year through. So just wanted to name that and say welcome back, everyone.
Yeah, totally. Do you want to name any intention briefly before we start?
Absolutely. Yes, I would love to. So I pick a word every year, and this year I've picked the word to slow down. And challenge that urgency culture that is within me.
Yeah.
And I think I've been doing a good job already. So happy that I'm trying to manifest slowing down.
Awesome. That's so challenging, especially at the new year when it's all like resolutions and like all this energy to like accomplish things.
Oh my gosh, it's all about speeding up. I mean, the amount of people showing up to my Zumba class has been like astonishing.
I bet.
This January.
Yep. Give it a few weeks.
What about you, Sharon? What are your intentions for this year?
I have I've been inspired to choose words ever since you told me that you do that. And this year I'm trying it a little differently. I chose a word on my birthday for my birth year, and that word is nurturance. So I'm really trying to nurture myself and think about how like how to do that in every corner of my life. And then for the new year, I'm choosing a word for my business, and the word is community.
Oh, I love that idea. I love that
Yeah.
you do both for your birth year and for New Year's. That's great.
Yeah.
And community, I like both of those. Nurturing community, you can put them together
Mhm.
too.
Exactly. Yeah. Yeah. I'm really thinking about like how can I nurture my community? How can I nurture myself? And how will that impact my community?
Yeah, those all great thoughts.
Mhm.
Well, so moving into our topic.
Yes. What is neurodiversity?
What is neurodiversity? Well, my understanding of it, I do want to preface by saying that I feel like this is a fairly new concept. Well, it is a fairly new concept. It was coined in the early 1990s, I believe.
Yeah.
I'm forgetting her name right now.
Judy
The woman,
Singer, a sociologist.
Judy Singer, sociologist. So she coined the term to be more inclusive with when talking about intersectionality.
Mhm.
Um, And I feel like that word has, or the concept has become more popularized really in the recent, like since the pandemic, I would say
Yeah.
since 2020, you've been hearing it a lot more. I think the younger generation, those Gen Zers are using it a lot more. Um, and so yeah, it's not something that when I was going to grad school or even when I was actively working in the social work field, it was not something that we were using very much. So I do want to preface by saying it's not, neurodiversity is not a conversation that I have gotten into too much. So I am excited about today, but I definitely feel like a little bit of a newbie getting into it.
I so
Um,
appreciate hearing you say that, because I think sometimes I put a lot of pressure on myself to like be an expert, especially with neurodiversity, because I brought that into my work quite a bit. Um, and yeah, I don't feel like I know everything, and I don't want to feel like I have to know everything. So yeah,
Yeah,
totally.
exactly. And again, these are exploratory conversations that we're having, and we're bringing listeners in, and we always value people's comments as well and feedback, and we're always available and excited to hear those as well.
Yeah.
Um, so basically my understanding of neurodiversity is in the word itself. It just means that we all have different brains and our brains work differently. But more specifically that we can have, I think it's been used a lot when talking about autistic people, that they've sort of taken on that word, or people with learning disabilities as well,
Mhm.
um, uh, that they've taken on the word that for a long time, being autistic, had, or still does, has a lot of stigma on it, that there's something wrong with you, there's something wrong with your brain, and that's why you socialize the way you do, or you don't have language mastery, or whatever comes along with that.
Mhm.
um, and I think with the word neurodiversity, it's really saying, okay, well, we all have different ways of thinking. It does not make one way better than the other.
Mhm.
um, so that's my sort of blanket understanding of it.
Yeah. Yeah. I understand it in the same way that, yeah, like every nervous system um, functions differently, and there's no right or wrong way to function. Yeah.
Yeah.
I
And
think
so what we're
everybody's
really talking about, it's almost, I mean, it is part of like the social justice movement of,
exactly.
um, you know, just because like my brain is different, it doesn't make me less than,
Mhm.
what,
Exactly.
than the status quo.
Right.
Um, so, which is interesting because of course we're all individuals, we're all different, we're all unique, we all have, you know, unique um, sensory processing. We all have unique moods. We have all unique biorhythms.
Yeah.
So I think it is also in celebration, by using that word, we're also celebrating our differences.
Yeah, it's important to see things differently, right? Like if everybody looking at one situation was seeing the same things, then we would be missing something, or we wouldn't have all the ideas that we need to solve problems. I like it's like really important. Like I'm thinking about the difference in thinking patterns. Like some people think linearly, where they go from one thing to the next and they can just see a goal and go straight toward it. And then other people have more associative thinking styles, where it almost like branches out like a web. Like, ooh, I'm thinking about this, and now that makes me think of this other thing over here. And how that way of thinking is so important for like thinking outside the box and recognizing all aspects of something, or just creativity and like coming up with something new.
I love the way you're describing it and talking about it, because it's sort of similar when we were talking in season one about symptoms, that we're not looking at like um somebody as a label, or a word that's describes a box that you get put into, but it's really more about our unique and individual behaviors and ways of thinking, and sometimes symptoms that have to do with our suffering and not feeling well as well, because that's unique too. It's more like all of the little things that make us as individuals.
Yeah.
um yeah. And I mean, what gets me thinking, and it's interesting because I, was diagnosed and labeled with mental health disorders from a very young age. Like the first one I got slapped on was separation anxiety when I was 9 years old.
Wow.
So a lot of my identity, I wouldn't say now, but a lot of my identity sort of growing up, was included these disorders that I was given, and I was given many throughout my time, which is usually what happens. So like once you get into this world, um, whether it's because you're seeing different psychiatrists or insurance or blah blah blah, you get slapped on all these labels, or
Right.
also the overlap of all of these mental health issues.
Right.
Um, they're so close together, they're so connected, right?
Mhm.
So yeah, like I don't know. And when I think back on it now, I feel very conflicted and confused, I think, about all these labels. Um, I don't even really use them anymore. And I used to use them in a way, not with pride, but I felt like, okay, I have this thing and I'm not going to hide from it, and I'm going to speak about it to connect with people and try to end stigma. But yeah, but the older I get, and actually with the word neurodiversity being thrown around more now, which was not something that was happening while I was growing up,
Yeah.
I do feel, in a way, I feel that power of like throwing out all these labels and just being like, yeah, I'm different. I'm
Mm.
neurodiverse. I'm different.
Mhm.
That's it, you
Yeah.
know?
Yeah. I love that. You sound really empowered when you say it like that.
Yeah. I mean, because it gets confusing. And I don't know if you've had similar experiences. I think you have, like going through all these mental health avenues, and we've been open and honest. So I'll just say, like, I have, like, if I give you the long list, it's like, okay, I have an eating disorder, I have bipolar 2 disorder, I have general anxiety, I have panic disorder, like it, like blah 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 blah, like I have ADHD, like I've gotten all of these labels, and what am I supposed to do with all of that? Like,
Right. Yeah.
I
It
don't know
kind
what
of
to do
sounds,
with all of that.
yeah, it sounds like
Yeah.
a collection of them. And I have had similar experiences. And I've have labels of adjustment disorder with anxiety, social anxiety disorder, post-traumatic stress disorder. And like one of the common themes is like every label has disorder attached to it, which kind of like when you get these labels, and not every I haven't known every label that every professional has given me, because a lot of times they don't even tell you.
It's true.
They just like decide. And but when I do find out, then I'm kind of like, so on the one hand, it's kind of like, oh, like that explains a lot of things. But then on the other hand, it's like, wait, am I just collecting these for my, and they follow me for my whole life? Are these labels that are just like, that's me and that's it? And there's no like overcoming that, or like are any of them temporary? Like can you heal from them? Like it's just like this collection of labels that contribute to your identity, and all of them say disorder.
I mean, yeah, and obviously the word disorder like inherently means there's something wrong with you. Like that's what is pointing to. And we have to remember also that these mental health labels come from the medical profession.
Right.
And so the medical profession looks at disease, they look at what's wrong with
Yeah.
um yeah, and sometimes the medicalization of mental health, I mean, I think has been actually a big disservice to mental health in general.
Hmm.
Because the medicalization means, pushing pills. And again, I'm on an antidepressant. Like I'm never going, tell everybody to get on one. Like it would probably be good for them. So like
Right.
very grateful for modern medicine. I'm very grateful for medication.
Mhm.
I've seen medication help many people, including myself. And at the same time, there can be an and. I think, yeah, I think that there's been jumps to using this medical language and things like medication, Western medicine, when somebody's suffering from a mental health crisis, let's call it that, or a breakdown in their mental health, um, instead of looking at the whole person, we're looking at it as a broken leg.
Yeah, and also not looking at the environment that the person is in and the ways in which the environment contributes to their health status.
Absolutely. Yeah. I mean, and that's what that originally I was interested in social work, or I was attracted to social work because social work is more about looking at person and environment,
Hmm.
not because I could have gone the clinical psych route, for example, but that to me just didn't feel right because you're saying there's something wrong with you, right?
Yeah.
Like it's looking at what's wrong with you instead of like what are all the things contributing to this breakdown in your mental health.
Hmm. Yeah. Thank you, social work, for taking
Yeah.
that perspective.
Yeah, no, I really appreciate it. And I think that's why I appreciate the word neurodiversity, because it is also sort of this um this pushback to the medical labelization and labelization. I don't think that's a word. The
I love it.
pushback to
It is now.
it is now. I made it one to mental health, or to the labeling of mental health in in a like in a disease format.
Yeah, 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 and I think that was the initial aim of neurodiversity, was to like be like, actually, everybody is unique. There's not one way
Yeah.
that like these people are doing it and another way that everyone else is doing it. And I want to introduce additional words that we can use that even strengthen that like non-deficit um, perspective, which are the words neurodivergent versus neurotypical. So yeah, so,
Do tell. I'm waiting.
so neurodivergent is a term that was introduced by somebody else named Cassiane Asasumasu in 1999 or 2000. And this is a term that just describes that individuals or groups of individuals have different ways of functioning neurologically than the dominant societal standard of what is quote unquote normal. Um, and neurotypical was then came about as sort of like the opposite. So neurotypical people do function within that dominant societal standard of quote unquote normal. So these are not medical labels, these are social justice terms. They're not diagnoses or anything like that. It's just a description of like in our society when we expect or like our views of certain behavior as normal, um, people who can operate that way. And I kind of think it as like people who can operate in society, like in schools and workplaces and public places, and who don't need additional support to be able to function within those environments. And then neurodivergent people diverge from that norm, they separate from that norm and are different, and sometimes do need supports in order to be able to participate fully in the established environments. But that's not because there's something wrong with them, it's because the environments are catering to or are built for neurotypical people.
That makes a lot of sense. I definitely identify with being neurodivergent.
Same.
I honestly I cannot function it's true. I can't function in a workspace at all. I can't what's expected of me. It completely breaks down my mental health.
Mhm.
Um which is why I'm living in Italy.
Nice.
And I'm trying to do things differently because yeah, it's absolutely like I would need to be like, heavily medicated to be able to function in those spaces.
Yeah.
Um, because what's expected is a lot of like masking, a lot of like pretending, a lot of political sort of games and masking and not wearing your emotions on your sleeve. And
And
I
sitting
just
still a lot of the time.
sitting still. Yeah.
Mm.
And that's true. Sitting still, not rolling your eyes.
Yep. Saying yes, sir, and not asking questions.
Yeah. Yeah, but but sometimes I also ask myself, like, who is neurotypical? There has been so many like people just burning out left and right, working in these jobs. I mean,
Yeah.
nowadays, like the people that I meet who can survive those environments without extra help
Mm.
seem to be very few and far between. Or some people are just better at holding it together.
Yeah. Yeah, but they are still suffering in some way.
Yeah.
Mhm. Yeah, I wonder
Yeah.
that too, because like a lot of what we perceive as normal behavior also is kind of like quote unquote civilized behavior.
Mhm.
And it like this kind of like makes me think of like the, I guess, colonization of America, you know what I mean? And this view that indigenous people were uncivilized, even though they
Mhm.
had extremely developed societies. And we even copied, their government structure because it was so much more advanced than Western society. But like, so like what is normal then? Like, is it just what we think of as civilized, but is that even normal for humans? Or is it more normal to be like more wild and like listening to your body and living in line with the rhythms of the earth, And like getting upset when things are upsetting, and not holding it in or pretending everything is fine.
Yeah, I mean, so okay, I'm listening to this book called Hunt, Gather, Parent.
Ooh.
And it is a parenting book, but it's also, I think everybody should read it. It's very eye-opening. And one of the things that the author introduces us to is this piece of research where, first of all, they call Westerners weird. So
Ooh.
Western educated, industrialized, rich democracies.
Oh, I love it.
And apparently I'm going to say we because Sharon and I are part of this weird population,
Yep.
are make up a very small percentage of the world. Very, very small. It's like 11% or something.
Mm.
And apparently we have very weird behaviors compared to
Mhm.
the universal humans and how they behave
Oh, wow.
in the rest of the world, in the rest of the 90%, which I just, found so fascinating. And also she introduces, which I knew before, but I'll say it here, that 99% of our psychological field, the research has only been done on these weird
Mm.
populations. And
Yeah.
so our understanding of like human behavior, and this includes things like mental health labels,
Mhm.
are in fact completely unapplicable
Mm.
to most of the world, to 90% of the world. I mean, I'm just trying to like turn this into bigger picture of
Yeah.
how like Western society culturally has developed these very strange ways of looking at ourselves.
Mhm. Wow. Yeah. Thanks for saying that. That's like really eye-opening. Mhm.
Yeah, especially because when you're in these Eurocentric worlds,
Mhm.
we view ourselves like there's this elitism that comes in, and we view ourselves as having more knowledge, and our knowledge is more important, and everybody else has nothing to offer. And this particular book is about looking at parenting practices in small hunter-gatherer communities that still exist, that have been passed down for generations. And these kids are not suffering from things like depression and anxiety, and this all ties back to, in these Western worlds, like these generations, I mean, they're saying that they're suffering from loneliness like never before, and so are adults, not just teenagers.
Yeah.
And so I think I'm saying all this because it's really like time to look outside of ourselves, this culture, and not to romanticize other hunter-gatherer cultures, that communities that are still in existence, like they struggle a lot. Like there's things that are very difficult and challenging, and I think it's also would be it's not good to go flip the coin on the other side and romanticize also, but there is things to be learned from each other. Yeah, that's what I have to say. I don't know if you have a response.
Well, it sounds like eliminating a hierarchical view of the world, like not looking at a certain society as better, and the other one as worse, or not looking at one society as developed and the other as not developed, or first world versus third world. It's like, no, they're just different. They're both valuable. We both have things to contribute. And we can't discount things, or discredit things just because it's different than the way we would do it.
Yeah, and you know what, this goes back to the neurodiversity also, like it's the same thing for every individual.
Yeah.
And it's a disservice to humanity and to society to try to create this like normal box of functioning.
Hmm.
Because as you and I have seen in our previous work, people who have pretty severe symptoms of mental health conditions, I'll call them conditions for now, are able to be productive, very productive
Hmm.
parts of society if we would allow them to be.
Hmm. Yeah, yeah. I appreciate that word allow, because there is a definite gatekeeping.
There
Um,
is.
like you were talking about with employment, like only
Yes.
certain people can function. And then if you can't, then you have to ask for an accommodation, and it's supposed to be reasonable, which just means that it's supposed to not cost the company any money, you know? And sometimes you don't get what you actually need, even if
Yeah.
it's
Yeah.
reasonable.
Yeah. Well, and it's interesting also because with mental health, well, I was also okay. So I was going to go back to mental health labels because I was thinking about also like at work. Sorry, I just got lost again in my head. I was listening to you so well. This always happens to me.
It's okay. Sometimes I think maybe your brain needs a pause to like integrate what we just said. And on
Well, I also
this
have
podcast,
that
you're
brain.
supposed to
I
just
have,
talk. Oh, sorry.
oh no, no, sorry. I have that brain you were describing earlier. Like I get these ideas while I'm thinking or listening, and it's just hard to categorize everything and respond appropriately.
Right, because maybe you need more time. Like my brain, I'm super sensitive in multiple senses. And so my nervous system is picking up on a lot of information, and I need time to process it. So I like sometimes in social situations, things are moving so fast that I like feel like I can't keep up with the pace that I'm quote supposed to unquote. And yeah, and sometimes it's like, I actually need to pause and just listen to what you said again, or just have some silence for a moment to catch up so that I can analyze all the information before I respond. But that's actually like a weird thing, or not a weird thing, but like a uncommon thing to ask for or do in a conversation.
I love how you're describing this right now because this is exactly what we're trying to point out in this episode, which is, you have a very specific way of socializing and processing information that's also a very powerful. It makes you an observer and somebody who thinks carefully about what they're listening to and then how you will respond.
Mhm.
And I love how like you feel empowered enough to actually say, hey, wait a second, I need a minute, because then you're able to use your strength. And I think that's what's really beautiful. Like if we could all be more accepting of each other and our differences, of even our neuro differences in that way, how we process things or how we think or how
Mhm.
we are socially, then you really get to pull from people's strengths more, and that creates like a better world to me.
Mhm. Oh, yeah, absolutely. Wow, I love that you just described it that way. That like catering to our individual needs allows us to access our strengths and contribute more to others.
Yeah, exactly. Because otherwise, and I'm sure you've experienced this, you feel like, oh, I have social anxiety. I just can't say anything. I'm just gonna sit here and like
Yeah.
just be anxious.
Mhm. Yes, that's like
Yeah.
most of my life.
Yeah, exactly.
Mhm.
Yeah, and that again, like that's just that for you, that's not good for you. It's not good for the people you're with. It's not good for society on a whole. And yeah, I think that's just what's been so not helpful with trying to standardize people, make people think.
Mhm. Yeah, absolutely. Hmm. Wow.
But I also want to say, with when it comes to mental health labels, there are two sides of the coin. Mental health labels, I think, can also be very helpful.
Mm.
Um, I know well, especially I can go back to the separation anxiety label.
Yeah.
Knowing that when I was 9 was a relief also, because I really thought there was something wrong with me. I couldn't go to school. My parents thought there was something wrong with me. I couldn't go to school in the morning because I was so anxious. I would have panic attacks. And to be able to say, oh, this is what's going on with me, was really important. But I guess it's just the verbiage that we use, the disorder, the disease. If we could label things without that word next to it, because power of words, power of language.
Yeah.
And I've always been a big advocate of just describing symptoms.
Yeah.
But in that moment, as a 9-year-old, I did need the label that set me apart from other kids to get help and to be able to ask for help.
Mhm. Yeah. And it sounds like maybe even to understand yourself better.
Also, also.
Mhm.
And I think now, for some reason, those labels, I mean, it doesn't mean that I don't have any of the symptoms anymore.
Mm.
Um, we were talking earlier with the label. Does that mean it goes away? I had a psychiatrist say that you're in remission when you are feeling better.
Oh, okay. Interesting.
Like, so it's a part of you, but it never goes away. So you can be in remission, I guess.
Okay.
But I just don't feel the need to describe myself with those labels anymore. And it's not because of stigma, because I'm not afraid of what people will think of me if I use those labels. But I just don't find them valuable in when I'm talking about myself, or even when I'm having a hard time. I don't find it valuable to say I have this. I more will say I'm feeling this way,
Mm.
or I'm having a flare in my anxiety.
Mhm. Yeah.
you know
Uh-huh. Totally. I think I'm relating to this through my exposure to the term and label neurodivergent, because I didn't have I didn't get any labels or have access to a mental health professional until I was in my 20s. And
Mm.
then I didn't know about my neurodivergence until I was in my 30s. And so I had a long time of believing like there was something wrong with me and not having language to describe my experience or to ask for help or to say what I needed. And so when it wasn't until I was in OT school that I learned about sensory processing and understood my hypersensitivities and differences with how I process sensation. And then when I came across the term neurodivergent, um, that was when I was like, oh my gosh, this label is so helpful because it was like finally having a way to think about myself that was not disordered or wrong or defective. And really having an understanding of sensory processing helped me to recognize, like, oh, I just need more time in social situations, or like I can't spend as much time in certain environments because I get overstimulated, so like it was I think I have a similar experience of feeling like the terms are helpful, the words and labels are helpful.
Mm.
um that yeah, so now I have more acceptance of myself because of those.
Yeah, so there's, I mean, there's obviously a place for them, and that's important too. But yeah, I think the disorder, those terms are just becoming archaic a little bit.
Hmm. Yeah, right, because like yeah, it's like too much focus on what could potentially be wrong with an individual, like we were saying before, and not enough focus on the big picture and like what else is actually happening, or the fact that like you're just different. That's not wrong. It's just you're different and
And
you need.
it's not strengths based also,
Yeah, yeah, exactly.
and I think it's like you're trying to do, I mean, this is definitely, it's a hard thing, a hard distinction because, okay, so let's say I have a mood disorder. That's what I used to tell people because I didn't like to say bipolar too because people didn't understand what that meant. So I'd say I have a mood disorder.
Mhm,
And so what does that mean? It means that I am pretty sensitive
mhm,
and that I have labile moods. And I do. It is also part of who I am. Like I just am like that. Sometimes those moods have gone into spaces where I have not been able to function properly.
mhm,
And not just like in everyday, not just in social or where I'm supposed to function, but actually enough that I am suffering on an internal level and can't enjoy things. And that's when I guess it becomes disordered, right? Or that I need to ask for help. But yeah, it is also just part of who I am, these labile moods, right? So, and this is where again, where I don't like using the word disorder, but then sometimes my labile moods get into a space where I do need some form of outside help.
mm,
So it's a little like confusing to me. Um, and in my life now, for example, had, I haven't been so up or down that I've needed external help in a long time.
mhm,
Maybe that's why I don't use those labels as much. Or
mm,
maybe I've just learned how to manage it better.
mm,
And I just don't feel that need anymore to use them the same way. I don't know. I'm
mm.
not sure.
Yeah, well, it's making me think of how you said that's why I moved to Italy. So I'm wondering, like, did you find an environment where you can thrive and maybe and also you know how to take care of yourself better and you understand yourself better, but like that combination of knowing self, having coping strategies, and having a supportive environment means that like the disordered part doesn't feel like it's there anymore because you're in an environment where you can function and thrive.
That I think that's what it is. So it feels almost like wrong to use that label now because I'm just not in that space and haven't been in a long time. Or if I feel myself going there, like
Mhm,
you said, I have the tools, the ability, the right environment.
Yeah.
to be able to stop, stop it from going out of those norms. And also, I just feel like myself, like if you ask me what I am or who I am, I'm Angela. I don't know. I'm
Mm,
Angela. I've got funky moods. I have a chaotic brain. Uh, I get really anxious that people are mad at me sometimes, and those are just all parts of who I am also,
mhm,
and I know that those things can get a little bit out of whack, and but then where does the line begin and where does it end of like what the disorder is and what's not? That's why I don't like the labels. That's why I prefer symptoms, because
mhm.
that is more like, okay, I'm experiencing these panic attacks. Like that's such a different thing than saying I have a panic disorder.
Totally. Wow. Yeah. Such a shift. Hmm. I was thinking of something
Yeah,
and I forgot.
yeah, welcome to my brain.
Oh, yeah, like, talking about symptoms is more specific, that's what I was thinking about. And then I was
Mm-hmm.
thinking about those terms high functioning and low functioning, which often get applied to autistic people, and those terms don't actually mean anything because they are not specific, you know? I think basically actually one of my, mentors, Deborah Pitts at USC, she hated those terms, high functioning and low functioning, because they were not specific. And she's like, really, what people mean is whether or not the patient or the individual can talk to you and tell you what's happening.
Yes, that's so true.
Mhm.
That is
Like,
basically
yeah, and even if somebody doesn't use verbal language, that doesn't mean that they're not aware of what's happening or can't tell you in some way.
right. Well, that's because we're a culture that heavily relies on language.
Mhm,
By the way, that was the other interesting thing. And that book I was talking about earlier, The Hunt Gather Parent,
mhm.
they also talk about how us weird weird people, I love using that. So Western culture that we rely heavily on language, and we do with raising our children. Many cultures do not
Yeah,
hyper focus on language. They use other forms of communication. But because we're so, Eurocentric in the way that we think that this is the right way to do things.
mm,
You get told when you have a baby, talk to the baby, narrate everything that you're doing. Like, where did we get that advice? That's not, I mean, I don't know if it's a bad thing. It's probably not, but that, yeah, it's not based in any scientific evidence.
right.
So,
Yeah, yeah, and telling kids use your words. I feel like
right.
that's not helpful.
No, and trust me, the mother of a three-nager, sometimes she is not cannot use her words, and it's
Right.
just she's not able to. She's developmentally not able to in certain moments to use her words.
Yeah.
So, but I think that's interesting, especially when we're talking about autism, because that is such a marker for when we decide to call someone autistic.
Mm, yeah. Wow. Mm,
And autism also, I mean, talk about neurodiversity in that spectrum. There are it looks so different. I mean, that's why that term almost doesn't even work for me, because you've got just such different manifestations, or like individuals within that umbrella.
yeah,
It's just like, what is this umbrella anyway? Like, if that makes sense.
exactly. Yeah. Yeah.
And I kind of feel the same way about some of these mental health labels. Like now
Mhm.
everybody has depression, everybody has anxiety.
Mm,
So what are we? 100% of the world now is all going to have an anxiety disorder. I mean, that also, yeah, that doesn't really work. Like people have had episodes of anxiety and depression throughout their life. People have burnout. A lot of times these things are situational
yeah.
because of our environments.
Mhm.
But then we're going to slap these labels on 100% of the world. Like what is normal? Like it's going to become the size of our pinky.
Mhm.
Nobody is going to fit in the box.
Yeah.
So that's why I also say I think these labels are archaic, because it's just everybody's mother and sister and brother has a disorder these days.
Mhm. Yeah. Wow. Hmm. I wanted to go back to talking about language and like verbal versus nonverbal, and how like verbal language is only one small way to communicate. Because with our dogs, they don't use language. And I think there's something about being neurodivergent and like knowing that and accepting that about yourself, and then having that contribute to your ability to understand your dog better, maybe. But then also there are challenges with dog guardianship when you're neurodivergent and have different ways of processing or experiencing sensation and things.
Definitely. I mean, I can think of challenges that have to do mostly with being sensory overloaded.
Yes.
So if you're sensitive to hearing, which I am, like barking and
Hmm.
uh whining can really
Oh,
like hit you in a different way.
yeah. Yeah, it's like there are certain types of barks and whines that are physically painful to experience, and so then yeah, that contributes to your ability to understand your dog or to show up for them or respond to them. And it impacts your capacity for experiencing sound or sensation across your day.
Yeah, and also like the chaos of well, I don't want to use chaos, but maybe the lack of control that you have over another being, such as a dog,
Hmm.
can be very triggering for some people,
Yeah, especially with a reactive dog.
especially with a reactive dog. And so, depending on your own reactions or how reactive you are,
Mm.
I was just talking about my own moods, that can trigger you also to feel a certain way or get into a certain mood.
Mhm. Yeah, I can definitely attest to that. Like, because I was speaking before about social situations happening so fast and needing more time. And then when I'm walking Muggins, that's a social situation because Muggins has a social demand on me, for example. Like they need me to pay attention to them and tell them things and also listen to them. And then if we encounter anyone else on the walk and that person talks to us, then it's like,
God forbid.
I know, right? And that's how I
Yeah.
feel sometimes. I'm like seeing people and I'm like, oh my goodness, what if they come, like where should I go? How close should I get? Like, what am I
What
gonna
triggers your
say?
anxiety? Yeah.
Right. And
Yeah,
like,
yeah.
depending on what they say, and especially if it's like they ask, is your dog friendly? Like that question trips me up so much because it's not a yes or no question, really. They're pretending that it is, but it's not. And then they are thinking that they're asking, can my dog say hi to you? But they're saying, is your dog friendly? And then like my brain is trying to process all of this and like also look at like, okay, how is Muggins feeling right now? And what is that other dog doing? And if I say yes, what are they going to do? And if I say no, what are they going to think? And what should I do right now? And like all of this is happening and I'm like, ah.
I
And
think we're sensitive to like that's why I use the word chaos. We're sensitive, and I only started using that word because of my toddler, because of the chaos she brings in my life.
makes
But
sense.
I feel very sensitive to it. And when things get out of order, it just creates, I don't know. I think for people, neurodivergent people, it triggers like a stress response, right?
Hmm.
And the more beings you have around you, the more that stress response is going to be activated.
Right.
Um, and that's hard. That's really hard to deal with. I think I struggle with that a lot. And I struggle with that with my dogs too. And sometimes it can look like anger, the response, the stress response. It can look also like feeling guilty, like I'm
Hmm.
doing something wrong.
Yeah.
But it can totally spiral me, mentally.
Oh yeah.
Absolutely.
Totally, same. Yeah, like I've had experience where Muggins like pulls me toward another person and a dog. And like however that turns out, whether it's like Muggins rushes up to the other dog too fast and the dog gets scared, or Muggins pulls me off my feet, or I'm just like embarrassed because my dog is pulling me down the street. And then the person says, who's walking who?
Yeah.
You know? And then I'll go home and I'll just be in a shame spiral the rest of the day, and
Yeah.
why,
Yeah.
and I'm thinking like, why all the things that I did wrong, right? Like I didn't do it
Yeah.
right. I didn't set boundaries. I didn't guide Muggins enough. I wasn't strong enough, when it's like there are so many things that were outside of my control in that situation.
Well, and I think also on the flip side of this is that it can create situations to really help us learn how to cope with those things too, you know?
Yeah.
And I try to look at it like that also, that these are learning experiences to, okay, practice mindfulness, practice my breathing, practice taking a break, practice problem solving, um, which I think is, yeah, again, there's always two sides to the coin.
Mhm. Yeah. Yeah. So the flip side, I think, of being neurodivergent and living with dogs is like there are so many gifts and opportunities that the dog provides. Like one is like learning to recognize nonverbal cues in myself and the dog, and like really having a strong sense of like that is valid communication, and really validating myself. But then also like the sensory yummies, of like laying next to my dog and like or having them
Yeah.
on my lap and having that deep pressure and that soft fur and that warmth.
Yeah, that's my favorite thing to do these days. I love to lay with all of them on top of me.
I love that. Doggy pile.
Yeah. Yeah, I mean, and I think that's why dogs can be so good for your mental health in many different ways and not just in the traditional ways, and in the way that we're talking about traditional as in, okay, they obviously provide companionship and
Mhm.
we get those great hormones when we pet them, but they also provide us with these really great ex- uh, moments to help ourselves if we let those moments if we take those moments as opportunity.
Oh, I love how you said that. That makes me think about how I've sometimes I've struggled with anxiety in regard to my work, and then that causes me to like have difficulty taking breaks. And Muggins has been really helpful because um I allow Muggins to like come in to my office, right? And they'll come and get me and ask me for things like, can we go play? Can we take a walk? Can we eat now? And I've had to make sure that I always listen to that. And that has actually helped me to have an easier time taking breaks from work, which means I don't get as anxious when I'm working because I'm taking breaks more often. And I have a really like fun way to remind myself to have a break, which is my like cute puppy is coming and putting their chin on my lap, and I'm like, oh, cool, it's break time.
I think that's also shows, I mean, and that's the power in what we were saying, that you're taking the opportunity. Some people could just be like, go away, be quiet, leave me alone.
Yeah, I
And
get that. Believe me.
I think that's so important to look at to that we look at those things as opportunities and take them, grab them, grab your
Yeah,
puppy.
exactly. Puppy opportunity.
Puppy opportunity. Oh, that's a good one. I like that.
Mm.
Shall we take a break and hear from our sponsor? I
I
feel like
think
this
we
is a
should.
good spot. Well, we started talking about things that help us,
Yeah.
including how our dogs help us. And I feel like we can definitely continue this in our second part.
Okay,
So
cool. Yeah, let's do it. We are so grateful to Benson's Pet Center for partnering with us on today's episode. Benson's Pet Center is a multi generational, family owned, and operated business with 8 locations in the New York capital region. Benson's has the largest selection of pet food in the area. If they don't have what you're looking for, they'll even order it for you. You can bring your dog with you to pick out their favorite treats, and you can even give them a bath at the self serve dog wash in 3 of their locations. Benson's has competitive pricing even on subscription services, and I love knowing that my dollars are supporting a local business. The customer service at Benson's is consistently unparalleled, and the staff's extensive knowledge on pet nutrition is amazing. Can't make it out to the store? No problem. Order online before 3 p.m. on weekdays, and Benson's offers same day delivery. And curbside pickup is available 7 days a week. Benson's Pet Center, where the motto is, we love your pets. Thank you, Benson's. Now back to the show. Welcome back, everybody. So before the break, we were talking about puppy opportunities or things that your dog might do that provide you with an opportunity to care for yourself. And now we're going to expand on that. And I really want to go back to like making sure that we talk about ways to resist the medical model of viewing different ways of functioning as defective or needing to be fixed. So, Angela, do you have any thoughts about that?
I remember, I'm gonna butcher this, but I remember actually at our last job, Sharon and I worked together, or where we met. We often talked about that maybe the people with mental illness are not us. It's actually society and the
Mhm.
builders of society who have the mental illness.
Yes, totally.
Yeah, which I thought was really powerful way of
Yeah.
thinking of it. Um, and our brains instead are just rebelling and saying no, like we cannot and will not be put in this box.
Yeah. Yeah. It's like trying to fit in that box. I think for me, trying to fit inside boxes in general, like made me live in ways that like were harmful to myself.
Yeah, I mean, that's what I was saying in the previous um, section about working in a normal, quote unquote, normal job.
Mhm.
The box that I would be forced to put myself in was just so unhealthy for me.
Yeah. Yeah, because you're like denying parts of yourself are there, and
Yeah, and denying thoughts and pushing down emotions and just to be able to function within the rat race and within the structure, the hierarchical pecking order.
right. Yeah. So how do we embrace our neurodivergence and get out of that box in a healthy way?
Good question.
Mhm.
Good question. I think it's hard
It is
for
hard.
me. I
Mm,
think, yeah, I still struggle where I go through days like, why can't I just be like everyone else?
mm,
But I think sometimes when I look outside of myself and I realize that everybody's struggling and maybe I'm not so different from everybody else. Maybe some people are just better at hiding it.
yeah, I definitely think that's true. Like if you're doing great in these systems of like work and school and those environments, that like what are you hiding? What part of you are you inhibiting?
Yeah. And I think that universalism for me anyway makes me feel better because it takes out the feeling of, yeah, it's not as egocentric of like what's wrong with me.
Hmm.
And I think that's what psychology and going to psychologists sort of do, and the mental health labels do that, that it makes it a you problem instead of a everybody problem or a societal problem. So
Mm-hmm.
thinking about it in that context for me is just helpful in general.
Yeah. Yeah. And I think at the same time, for me, it's been like learning myself has been really helpful, like really, um, like knowing that I have sensory processing differences literally changed my life, like it allowed me to be like, oh, I can't process sound the way that other people do. I have less capacity for certain types of sounds. So I need to set boundaries. I need to just say, like, I can't listen to that right now, or can you turn the volume down, or I need to bring earplugs to this party because I it's going to be too loud for me, instead of me just being like, oh, there's something wrong with me, and like hiding in the corner at the party like waiting to go home.
Well, I feel like that does two things. Like one, you're being vulnerable by sharing with other people. And I think that that also takes, like, vulnerability is the antithesis of shame, right? Like if you keep things inside and quiet, shame festers.
Yeah.
Um, and so yeah, being vocal and open, that leads to a path of acceptance, other people accepting you and you accepting yourself.
Hmm.
And also setting those boundaries, you're living true to who you are. That
Yeah,
feels good.
it's really good. Yeah,
Yeah.
it's like to have the words to be able to say like, this is what I need, like I'm thinking about I had this experience with my gynecologist where she's a talker, right? So like last year I I saw her, and she's like friendly and talking like throughout the whole thing, you know, and like, but this is an experience in which somebody has to touch me, you know, touch my body, especially in very vulnerable places. And if I don't know like where you're going to touch me and when or what it's going to feel like ahead of time, my anxiety just like explodes. I like get so tense. The touch actually feels more intense,
Mm.
and um and it's really anxiety provoking. So like before I had developed my skills with being able to say what I need and set boundaries, I would just go into these appointments and just it would just happen. And then I would get out of it and be like, she didn't even tell me what she was gonna do. And like, and then I would feel like violated, right? And but this year she was talking, you know, telling her stories, whatever. And I interrupted her and I said, I need you to tell me exactly what you're gonna do before you do it. And she was like, oh. And then she did. And it was like, I was like, oh, great. I just went to the doctor instead of feeling like I was just violated by a health professional, you know? It was
Yeah,
such
yeah.
a different experience.
That's such a different experience. But you're advocating for yourself, and
Mhm.
that's gonna make you feel good
Yeah.
inherently, right?
Yeah. It made me feel like I was showing up for myself. I was protecting myself.
I think one of the ways that I protect myself also, we were talking about all these mental health labels, but this is more emotionally. I think maybe, now that we're talking, part of why I've sort of stopped using those mental health labels for myself is also a way of emotionally protecting myself and showing up for myself and saying, I'm Angela, like I have these things, but doesn't mean that, I sometimes I have these symptoms, but that doesn't change who I am. And um sometimes I may need your help, but I'll ask for your help. But I think not identifying with certain things helps me just feel like myself, if that makes sense.
Yeah. Yeah. Like you're leaning into just like who you are and your core being and not worrying about like whether you fit into what other people perceive.
It's weird because I even do that, like I don't care too much for identifying markers in general. Like
Hmm.
even I'm an American, I'm a this,
Mm.
I'm a Colombian, whatever.
Mhm.
I just want to be me. Like I just want to be Angela.
Totally.
Uh, so I think there's a freedom for me anyway, 'cause in letting go of a lot of those assigned labels that I've been given,
Mhm.
you know.
Yeah. Yeah. So
I'm
that you
a
can really,
person.
yeah, you're a person. I love that. I like identifying as a human.
Yeah, I like that too. I'm human. I'm Angela.
Mhm. Exactly.
I am the name given by my parents.
There you go.
Yeah. I'm trying to think what I mean, there's so many of just of course like self-care things that help, but I think managing my lifestyle, and it sounds like it's similar for you, Sharon, like managing our lifestyles to fit our neurodivergence and our values
Yeah.
is what ultimately has helped us feel better as we've developed.
Absolutely. And I would give like I would say there are two specific skills that have really helped me to do that. One is developing my skills for consent and boundaries, like just being able to say, no, I can't do that, or I don't want to do that, or I need this, or can you help me with that? Has been hugely helpful for me to just be able to communicate my needs and get my needs met. And then the other part is something I call sensory budgeting, which is like
I like that.
really understanding my capacity for exposure to sensation and budgeting in terms of like making choices about what I expose myself to and engaging in activities that nourish my nervous system and like add to my budget so that way I can do the things that I want to do or need to do.
I love that idea. That's a really strong idea, I think, of how to move in the world when you have sensory sensitivities.
Mhm.
I think one thing that I really learned how to do is how to say no. It's part
Yeah,
of consent, but
totally.
I'm just branching out on that. But that
Mhm.
was like a word that I was very bad at using before. Actually, becoming a therapist, interestingly, taught me how to say no
Oh, awesome.
because you have to say no a lot.
Yeah. Mhm.
And it's really important to what you're saying. Like you have to budget. I mean, I think a big thing for me is that I don't budget my emotions properly in terms of giving people too much and learning how to. I think this is more personality related for myself, but that I to not burn myself out on giving,
Yeah.
um, and not burn my mood out. I need to protect my energy also. And
Mhm.
so learning how to say no in those ways, when people ask me favors or ask too much of me,
Mhm.
they don't know my boundaries. I know my own. And so that's been a huge, huge, huge helpful thing for me in general.
Mhm. Yeah, that's awesome. I'm so glad to hear you say that. And I think it makes me think of how, like, just like being assigned as female at birth and being socialized female, we are praised for saying yes, right? We're taught
Mhm.
to overgive and overextend ourselves in order to care for everybody else around us. And we're taught like that's the marker of it being a good woman, or like that's how you do it. And that leads to straight to illness and burnout because we can't give ourselves away to everybody
No,
else.
no, we can't. So, yeah, we have to protect ourselves emotionally, sensory wise. And I think the thing I would end on is that your tribe is so important. The people you surround yourself with are so important. And that's going to look different for everybody, of course, but having nurturing, supportive people in your life and knowing when to cut off relationships when they're no longer nurturing and supportive,
Mhm.
um, I think is like a huge part of feeling balanced and feeling well in your neurodiversity also.
Mhm. Yeah, definitely. And that's like such a hard thing to do, right? To like
Very,
say no
very.
in a relationship or
And
to
it's dynamic. It's always changing. I
yeah,
don't think that's not something that's ever going to be stagnant. Your tribe might not necessarily be the same, things are always changing in
right.
that way. But I think that's why it's important to be aware of it.
Mhm.
Um,
Yeah. Yeah, and going back to the idea of like dogs providing opportunities, because like dogs are a relationship, right? And
they're part of our tribe.
they're part of our tribe. Yeah.
Yeah.
And we need to be able to say no to them.
Mm,
Right? Like I'm thinking about like sometimes Muggins wants to go a certain way on a walk or walk for a certain amount of time. And I need to check in with my capacity. Like, am I getting hungry? Am I
yeah.
dressed for the weather? Like, am I cold enough or warm enough? And how's my social capacity? Do I have the capacity to give more instruction or to answer questions from other walkers? And I don't always. And I have to say, like, no, or I can't go that way. I have to go home now.
I think I have that a lot with being around them all the time because I have the capacity or not emotional capacity as in like physical capacity to be around them all the time.
Because of your
Um,
schedule and, like, how
because
you
of my schedule and my life.
yeah.
Yeah. So I can theoretically be with them all day.
Mm,
And I think sometimes learning when it's too much because it's not good for them, it's not good for me. I get frustrated and annoyed.
mm,
And I need space from them and they can be alone for a little bit.
yeah.
So that's something that I've learned to do with them. And again, like they give us these opportunities to learn these things, and to learn more about ourselves. They're just, yeah, they're very powerful
Mhm.
uh tribe members.
Yeah. Yeah, very important tribe members.
Yeah.
Mhm.
Hmm. Well, that was a really great conversation. I
Mhm.
really enjoyed it.
Me too. Yeah. Thanks for exploring this with me.
Yeah, and it was really fun to explore a topic that I haven't explored before. I really feel like I put my you know, what's that famous mystery man. What's his name? Oh,
Which one?
the one with the
Sherlock
big with
Holmes?
Sherlock Holmes. Yes, I feel like I put on my Sherlock Holmes hat
There
and
you go.
well, really came from a place of trying to find out the mystery.
Yeah, yeah, curiosity and not like
Curiosity.
judgment or like expertise, perfectionism.
Yeah. Yeah. All the things. Urgency.
Right, right.
Everything else we talked about. Success.
Yeah. Oh, that's so cool that we kind of like this season we went through this trajectory and like talked about all these things and kind of that helped us to get to a place where we could explore neurodiversity from such a different or like a diversity accepting perspective.
Absolutely. I think that's really cool as well. Shall we move into our care tip?
Oh yeah, what are you going to teach us today?
So it's called the humming bee breathing exercise.
Mm,
And so humming can be a very powerful form of calming your nervous system.
mhm.
Um, and monks have been using humming, and especially Hindu or Buddhist monks, they use um, humming mantras as a way to connect, with the spiritual realm, and connect with the earth as a whole, I would say.
Mm.
So we're going to practice doing that today.
Cool. That's awesome. Yeah,
Yeah.
like thinking about the vibration that you're
Vibration. Thank you. That's the
yeah.
word I was missing.
Mhm.
Thank you, Sharon, for always remembering or figuring out what I'm trying to say. I could not do this podcast without you.
You're welcome.
Who knows what I'm talking about? I just have trouble finding the words sometimes.
Yeah, I got you. No worries.
Thank you. All right, so what we are going to do, I'm actually going to put my microphone here because I need to. Can you hear me? Is this okay?
I can hear you. Yeah, is that comfortable?
Or it's weird. You know what? I'll just do one ear. So I'm gonna demonstrate with one finger. So we're
Oh,
gonna close our eyes and I'll walk you everybody through that.
mhm.
But what we're gonna do is we're gonna take a deep breath in through our nose, and during the exhale, we're going to cover both our ears and we're gonna just do a humming sound.
Cool. Nice.
Okay.
All right.
And you can do it for as long as the breath lasts. So
Okay.
we'll try to do it together.
Mhm.
Um, for as long as the breath lasts. And let's do it 3 times.
Okay.
Okay. All right. So let's close our eyes. Take one deep breath. And I'll count down from 3, 2, 1. And we're going to go for our first breath in. Now cover your eardrums and hum. Mm. Breath in and exhale, hum. Mm. And our last breath in. Make sure your eardrums are covered and hum out. Mm. Open your eyes when you're ready.
I love that.
Me too.
I feel like I can get really immersed in my own internal world when I do that.
Yeah, it feels really like rhythmic, and I feel like my whole body vibrate, my organs, but in the nourishing way.
Yeah, yeah, it's like really grounding because it's like helps you to really feel your body.
Yes. Yes, absolutely. And the thing is also, if you do this with other people too, you connect with the humming. It's like the and you find, you can hum at different pitches, but there's this amazing soul connection that happens when you're doing it together.
Mhm. Ooh, yeah, like we're all accessing a certain like frequency, like physiologically in our bodies.
Yes, 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 yes.
I love that. Thank you for sharing that.
So next week we're going to talk about neurodiversity in dogs,
Mhm.
and that's going to be a really fun one. I'm very excited, and that's going to be our last episode of season 2.
Wow.
I
Hey,
know.
good job, us.
Good job, us.
Yeah,
We need to celebrate somehow.
totally. Yeah,
Um, we'll find a way to celebrate, and we'll let you guys know, listeners.
definitely. Until then, do you have
And
any
oh,
Cloud Doodles updates to share?
yeah, you know what? I don't know if I do, because I'm just getting back into the groove of things. I would say just keep following along our Instagram. No major updates at the moment. Just getting back into the swing of things for 2024.
Mhm. Awesome.
How about you?
Yeah, I am still getting back into the swing of things. You may have missed me on Instagram. I've been on a little bit of a break there. Um, and that's because I am working on nurturing myself and my business and establishing foundations and structures so that I can cultivate community and engagement and like really operate in a way that's more sustainable for me. But I do have 2 workbooks that you might be interested in if you identify as neurodivergent or you just want to take a sensory-based approach to your relationship with your dog. One of them is a free workbook called the Sensory Overload Volcano, and that will help you to understand your dog's reactivity from a sensory-based approach and recognize all of the sensations across a day that might be contributing to their big explosive reactions. And then it'll give you a strategy for problem solving through that and learning how to adjust the environment to support your dog in having less and smaller reactions. And then the other one is my sensory safety planning workbook for $22. That one goes more in depth and helps you reflect on experiences that were difficult with your dog and then use sensory exploration to identify tools and supports that you can use or boundaries that you can set. And it has like activities that you can do with your dog throughout that process. And you can find both of them on my website, hc-collab.com.
Sounds great. Those workbooks sound amazing. Um, yeah, I guess we'll see you guys next time then.
Yeah, awesome.
All
Thanks,
right.
Angela.
Thank you, Sharon.
Thank you so much for listening. If you'd like to support the show, go to buymeacoffee.com/HDHH podcast and send us a few bucks so that we can stay awake and energized to make more content.
Even though we are licensed professionals in our own field of work, Angela, LCSW, Sharon, OTD, and CDBC, this podcast is not intended to replace individual therapy for humans or behavior support for dogs. We approach our conversations from an exploratory, observational, and strictly personal lens.
If you are struggling with your mental health, your dog's behavior, or if you or your dog have experienced a recent traumatic event, please see the resources section on our websites for a list of resources and places that can help. Visit either www.hc-collab.com/happydoghappyhuman or www.clouddoodles.com/happydoghappyhuman. This podcast is made possible by the collaboration between Cloud Doodles and Human Canine Collaborative. Check out our websites at www.clouddoodles.com or www.hc-collab.com. Special thanks to Tom Fox for support with editing and production consulting. You can find Tom at tomfoxphotos.com. Special thanks to Muggins, Duchess, Pepper, and Biscuit for sound effects and story examples. We could not and would not ever want to do this without you.